Welcome to another installment of Advancing the Good with United Way of the Lewis and Clark area. I'm Dana, the Director of Development and Marketing at United Way of the Lewis and Clark area. Today we're going to be talking a little bit about homelessness and how it affects the community and the efforts that are being made by even our own neighbors just to make sure that everyone in our community has a safe place to sleep at night. So joining me today is Trina Filan, a really lovely soul and the Community Impact Coordinator at United Way.
Hello, Dana.
Well, thanks for joining me today.
Thank you very much for the invitation.
Absolutely. So we have a lot of really cool things to kind of talk about today, even though we're talking about kind of a depressing subject, homelessness. So I know that there are a lot of homeless folks that we see out and about in the community, and most people in the area are not homeless. But there are some effects of homelessness on folks who even have stable housing, own a home, and local businesses. Can you talk a little bit about those? What are some of those?
Sure. So homelessness is actually a really important full community issue to think about and deal with. From the perspective of human rights and integration of all community members into our society, folks who are homeless tend to be pushed to the perimeters, to the margins, and often are not acknowledged for what they can bring to the community. Sometimes that might be hard to decipher, but other times I think folks are looking for ways to belong and there are no immediate invitations. So what that means is we are not acknowledging the talents, skills, and abilities of a certain segment of our population. And that is probably a little esoteric. So let's also talk about some of the more material and concrete costs. So even though folks who are experiencing homelessness are without housing, right? They incur a lot of costs to the public as a result of that experience. So many folks have mental illness, sometimes very severe. Some folks have really terrible addiction issues, and that's a public health issue. Some folks have had interactions with the criminal justice system for varying reasons, and all of these things make it hard for them to be housed and to stay housed. But if they're not housed, then there's a cost to public services, including emergency room visits for regular health care, use of emergency services vehicles, interactions with police, potential jail stays for relatively minor problems. Sometimes folks find ways to go to jail so that they can be housed and have a meal. So, and then there are also folks who access behavioral health services and crisis services. And so we have a system in place at the moment that's able to start tallying some of those local costs of those folks to our community. And over the course of about 6 months, there's an average cost of about $16,000 per person to the system if they were housed stably, even with a public housing voucher and with some case management services to help them with their mental health issues, help them stabilize. That's about $8,000 for a whole year. So $32,000 for a year for those public health services versus $8,000. So there's that cost as well. And finally, there's a cost and a problem regarding safety, right? And perceptions of safety. And perceptions of which people are okay and which ones are not. And so,
Sure.
For example, in the downtown area, there are a lot of business owners who have concerns about folks who are homeless and might be less stable and might be interacting with their customers or their employees in ways that aren't particularly useful. And so there's a real cost to our social structure as well. So there are a lot of things going on sort of under the surface to people, to businesses, to the community structure, and to our public resources.
Wow, that is a pretty tremendous impact in all ways, really.
Yeah, it's a very complex issue, and I think it's really important to remember that homelessness isn't always about transients. for example, like transience, IENCE, right? Is that the right spelling? Sorry. There are a lot of people who are experiencing homelessness who have lived in our community for 5 or 10 or 20 years. So it's not like it's the story of folks who are coming in for a brief time and then going out. There are some folks who do that, but there are others who live here. And so they are our neighbors, literally our neighbors. And because we haven't figured out enough adequate ways to compassionately invite them back into community, if that's where they want to be, then we're missing out. We're not addressing all of the issues that we could address for people who live here.
Sure, sure. But I think it's really interesting too, the fact that you have been working very collaboratively with a lot of different organizations in the community and kind of the surrounding area. You've had a lot of meetings and a lot of opportunities just to interact with those folks who are, excuse me, who are providing those opportunities to provide that compassionate hand and that invitation back into the community. So what are some of the things that you have been working on in order to provide that transition for those folks?
Sure. There are actually a lot of different programs, coalitions, and short-term work projects that revolve around the issues of homelessness and safe, adequate, affordable, quality housing. So that's obviously a continuum, right? There are folks who are never going to want to be housed. There are folks who would like to be probably but don't have the capacity to do it themselves. There are folks who have found themselves in a bummer situation and aren't currently housed or are working through some issues so that they can find some stability, some continuity in their lives, be good family members, good community members. And then there are people who have challenges with the housing that they have, right? We don't have enough affordable housing. We don't have enough well-structured housing. You know, there are places with lots of structural issues that need to be fixed. And then there are folks who just they would like to have a substantial place to live, right, for a long term. So there are a bunch of groups that are working on all these issues along this continuum. There is a survey that we just got done with, thank goodness, called the Point in Time Homeless Survey. And that happens once a year all over the nation, and it gives a snapshot of who is experiencing literal homelessness and who is experiencing precarious housing. And so that helps the federal government, the state government, and localities figure out how they're going to designate resources appropriately to deal with folks in their area, right? So that's the Point in Time. And the Point in Time is a project under the umbrella of a group called the Helena Resource Advocates. And HRA has been working for many years under various names on housing issues, homelessness issues, addressing basic needs, getting people to stability, addressing hunger issues. So it's a very complex network of folks, many organizations from the state, from the city, and from nonprofits, and from businesses. So HRA does the Point in Time, but it also does other work. It brings people together to talk about what's going on in the community, to share information, and it, in coordination with another group called the Coordinated Entry System Implementation Team.
Oh my goodness.
Also known as the Get Stuff Done team. So that group is working specifically on homelessness. And you know the system I mentioned earlier that we're starting to track folks and understand the kinds of services they use. Well, that system really is designed to identify the most vulnerable people and get them into housing and support services. So the idea is that you figure out, traditionally, until recently, housing has been dealt with as a secondary resource, and lots of community services organizations have focused on getting people stabilized, getting them sober, getting them stable as with mental health issues, and then housed. Well, it's very hard to maintain your stability if you do not have a place to live that is safe and warm and dry.
Sure.
And so there's a new-ish model going around these here parts, and it's a national model called Housing First. And the idea is to get people into housing and then provide them support services. So that is what the coordinated entry system is designed to do. Get people into housing, get them support services. So we have Helena Resource Advocates. We have the Point in Time survey. We have coordinated entry with the Get Stuff Done team implementing Housing First. We have a weekly meeting of housing and case management providers, and we figure out how to best place the people who are in our coordinated entry system. We also have a bed bug task force because we know that one of the big issues facing people who live in shelters or who live on the street or who might live in some kinds of housing conditions have a tendency to get bed bugs. It's a thing that is, it's a problem everywhere, but it's a concentrated problem in particular areas of our community. And so we've got a task force of folks dealing with that issue so that people can get housed and landlords are more enthusiastic about housing folks. And the pièce de résistance. We are, as a whole community, doing a housing needs assessment. And so this study is designed to figure out exactly what kinds of housing we need, what barriers there are to getting people stably, safely, and adequately housed in affordable circumstances, and then figuring out action plans for the entire community to undertake so that we can get to those points, so that people have housing. So it's not just about homelessness, it's about the continuum and all the barriers between people needing housing and people getting housing.
Right. Right.
It's a crazy system.
That's fantastic, though. I think what's really wonderful is the fact that there's such great momentum already, and there's facilitation of these solutions already being implemented in our own community, and really compassionate care being provided for all these folks who really need that help. But I think that also because the action plan and the steps that we need to take in order to really get the affordable housing and to figure out what our housing needs are in the area, that will definitely provide a little bit of support to help that group and those groups really move even further forward and to really be able to get those folks housed.
You bet.
That's wonderful.
There's a lot going on, and there are lots of ways that people who aren't immediately touched by this system, either as service providers or as knowledge providers or as clients and consumers, can get involved and help us move this work forward. We need folks who love data analysis and the reporting and communication of data in interesting and accessible ways to the community. We need to get into as many groups as possible to tell them about all of this good work, all the things happening, and invite them to participate in various ways. We really could use folks who have some design skills, some graphic design skills, maybe some intriguing website skills, much beyond my capacity. We need folks to share within their workplaces or to invite us into workplaces to talk about what's going on and to see if there are any problems they're experiencing that they also might have solutions for. So we need solutions. We need people to get involved with creating those solutions. This is a community issue. This is not about service providers and clients. This is about everybody. This is about our neighbors. This is about welcoming and health and community cohesion. I know those are all really esoteric things, but frankly, there's a lot of research that shows a direct correlation between housing access and health outcomes. So if you're homeless, you have a greater chance of having negative health outcomes. If you live in poor quality housing, you have a greater chance of having negative health outcomes. And all of the services that connect to housing, neighborliness, neighborhoods, walking trails, getting out and talking to people. Folks get isolated, folks get lonely. So all of these things are connected to each other, and it's not about one solution. It is about many solutions coming together, many people coming together, and it doesn't matter what your political persuasion is. It doesn't matter any of those things. It matters that we are building a strong community together.
That is incredible. That's a really beautiful vision, and I think it's really fantastic that you've been so strong an advocate for that. But also, if folks want to go ahead and provide those services that you're talking about, graphic design, data analysis, making sure they're getting out there and really advocating for these solutions, where do they go for more information, and who can they talk to about getting involved?
Well, they can always give me a call. They can email me, and we also have some of this information incompletely done on our website. As I mentioned, not a website designer. So if people are interested in learning more, they should call United Way 442-4360 and ask for Trina. They can also email me at trina@unitedwaylca.org. I would be happy to talk to them and invite them in to creating solutions.
That's great. Well, thank you so much for providing so much wonderful information.
You
today.
bet. I'm sorry if we ran over.
I
can natter.
It is a lot of information to distill, and a lot of really great steps forward, and a lot of really fantastic collaborative work that's being done.
There is a lot of good work being done.
Yes.
A lot.
Yes. Great. Well, thank you so much.
Thank you, Dana.
Yes. So if you would like to learn more about efforts to make sure that we are housing our most vulnerable neighbors, that we're really being compassionate and caring for one another and building a stronger community, please do contact us at United Way of the Lewis and Clark area. You can call 442-4360. You can email us at info@unitedwaylca.org or visit us online at unitedwaylca.org. Thank you.